Good morning, everyone. It's a great pleasure to welcome you all to Montclair State University, and I am particularly happy to welcome the Secretary of the Department of Health and Human Services, the Honorable Kathleen Sebelius, and our own State Senator, Gill. The university is enormously pleased to be partnering with this great leadership at the federal and state level to help ensure access to affordable health care for all people. It is an issue that is tremendously important to our own student population. It is important to the families of our students. You know, if the families of our students are having health care difficulties, then our students have difficulties. And if our students are having difficulties, that becomes a university issue. And of course, given our central location here in what is really, in terms of population, the densest part of the state of New Jersey, the densest state in terms of population in the nation, it gives us the opportunity to provide a real service to the surrounding communities. As part of this partnership, we're going to open today on this campus an Enrollment and Information Center, and that center will be staffed by Enroll America volunteers, and it will be open every single day from now through March 31st, including Saturday and Sunday. The reason we're doing this, and the reason we embraced this partnership, is because Montclair State has been committed to providing healthcare coverage for its students for many, many years. Because of that, we mandate that full-time students have healthcare coverage, and because of that, we developed with all the other state colleges and universities in the state a consortium so that we would be able to provide the most affordable possible care to our students. And you see behind me, students. They're recognizable by their beautiful faces and their red shirts. And the reason that they are here is because they represent student organizations from across the campus, and all of them have expressed a commitment to do activities during this last week to get the word out to the maximum number of people about the importance of enrolling for health care. I want to point out somewhere in the audience, Vice President Pennington, who is our Vice President for Student Development and Campus Life, and also Donna Barry, who leads our University Health Center, serving the needs of thousands of students and their day-to-day health needs all the time, all year long. In addition to healthcare for our commitment to healthcare for our students, the university is also deeply committed to advancing the boundaries of knowledge about important healthcare issues. And because of that, we are deeply engaged in a number of research programs and educational programs to serve that end. And I want to also recognize here today the provost of the university, Dr. Gingrich, the deans of the College of Science and Mathematics, Humanities and Social Sciences, Education and Human Services, Deans Present, Morrissey, and Peterman. As well, we have faculty here from the Department of Health and Nutrition Sciences. They are represented by, right over there I see them, Professors Birnbaum, Amata, Silvera, and Lieberman. Professor Thomas is here from the College of Science and Mathematics, and she heads up our Center for Quantitative Obesity Research, very important subject. And we have right over there Dr. Jerry Costa, who heads up our Center for Autism and Early Childhood Mental Health. Those are some of our engagements in the health frontier, but obviously not all of them. At this point, it gives me very great pleasure to introduce a real friend to the university, a person whose voice is always at the front and crystal clear about any issue that is important to the well-being of people, Senator Nia Gill.
Thank you. Thank you, Dr. Cole and Montclair State University for partnering and helping to organize Enrollment Week. Secretary Sebelius, welcome back to New Jersey. We thank you for all that you do to ensure that all Americans have access to quality and affordable health care. You are at the forefront of this issue, and we thank you for your leadership. I would like to thank the Get Covered campaign for their hard work in getting people enrolled. Organizers from the Get Covered campaign, as well as navigators, will be on campus until Monday, March 31st, to continue enrolling students and members of the community. This is crunch time, and we all must do our part to spread the word about signing up for health care, in particular, our young people. Look, I used to be a young invincible myself, and I can tell you that the last thing on young folks' mind is what will happen if they get sick. Nothing is going to stop them from doing what they want, walking around in the cold without a coat, or partying even when you're sick. But what happens if you don't have insurance? You're out there playing like LeBron or serving like Serena, and you get injured. You have very few options. Not get the medical attention you need, and then a minor illness or injury becomes a major one. Or rack up medical bills that you can't afford. That is why it is so important to enroll this week. While the Affordable Health Care Act can provide coverage, you have to enroll for the insurance. In just 4 northern counties, Essex, Hudson, Bergen, and Passaic, there are over 417,000 uninsured. Of those 417,000 people, 42,000 are children. This represents over 40% of New Jersey's uninsured children. Now, we are all working to put a dent in those numbers, and the last enrollment figures in New Jersey reflect that. Statewide, over 74,000 people purchased insurance on the marketplace. Over 80% of those New Jerseyans receive financial assistance. Additionally, 123,000 residents have signed up for Medicaid. That is a total of 197,000 New Jerseyans with new health care coverage. If you already have insurance, spread the word. Tell your friends, families, and coworkers. Like some of the young invincibles here, you can volunteer this week to help people enroll for the affordable health care. There are 3 really easy ways to enroll for everyone. By phone at 1-800-318-2596. 1-800-318-2596. On HealthCare.gov, or at a location where you could get in-person help. We invite you to come to the Student Center at Montclair State University this week and enroll with a navigator. Enrollment is happening across the country, and we are honored to have the Secretary of the United States Department of Health and Human Services with us today, Secretary Kathleen Sebelius. Secretary.
Thank you, ma'am.
Thank you. Nice to see you too.
Well, good morning, everybody. I want to start by thanking President Cole for not only having us here today and hosting this event, but for her leadership and the school's commitment to ensuring that Americans are healthier and more prosperous into the future. I want to thank the students. Thank you. Thank you for being engaged and involved and helping with this enrollment outreach and education week. And to Senator Gill, who has been a great partner in this effort in New Jersey. As a recovering legislator, I know how important your voice is in the state policy matters, but also that we're in your district and your outreach and education efforts are huge. Now, a lot of people are focused on the basketball tournament that's underway. I'm a little heartbroken myself because all the Kansas teams are gone as of this weekend, but I'll recover. What I think is important, and Senator Gill touched on it, is that for a lot of students, since we're here at the university, we know that people can sustain injuries when they least expect it. So a pickup basketball game, which a lot of young folks are involved in, can end up with thousands of dollars worth of bills. And just a week or 10 days ago, we put out the top 10 sports injuries that come through the doors of an emergency room. And things like a broken arm can cost $7,000 in this medical system. So without insurance, that's a lot of money to try and pay off over time. And as President Cole says, it not only jeopardizes a student, but it jeopardizes their family and the bankroll of that family. I'm here in New Jersey because across this state, about 13% of the residents are uninsured and eligible for new health care under the law. And New Jersey is one of the states expanding the Medicaid program. So there's no gap for individuals. They don't have to figure out if they are eligible for Medicaid or the marketplace. They just need to come in through the website, through HealthCare.gov, which is working very, very smoothly. CuidadoDeSalud.gov, the Spanish version of the website, is working very smoothly. And put in some personal information, and the site will direct the resident to the marketplace or to Medicaid, whichever is most appropriate based on income level of the family. We know that 88% of all uninsured and eligible residents here in New Jersey are eligible for financial help, and many of them for significant financial help. So this is, for a lot of people, the first time ever that they would have affordable, available health care. And there are lots of choices here in New Jersey. There are 36 plans in the individual market, and depending on where you live, where your zip code is, those plans vary from area to area. So it is, as Senator Gill said, easy to do. Come to the website, healthcare.gov, 24 hours a day, 7 days a week. Call the toll-free hotline. Again, callers are available in Spanish and in English, 24 hours a day, 7 days a week, or find local help. And here at Montclair State University, as President Cole has already said, there is going to be an enrollment center open every day for the next 8 days, which is really very good news. And if someone doesn't live near the university, go to the website at findlocalhelp.gov, type in your zip code, and you'll figure out where others are available in your neighborhood, in your community. So again, I'm pleased to have a chance to revisit New Jersey. A 27-year-old earning about $25,000 in New Jersey can find a plan for as little as $114 a month with the tax credit they're eligible for. My guess is they can't find a cell phone plan for $114 a month. It's often hard to find a cable package for $114 a month, but it is easy to find a health care plan that can involve everyone. So as we look at the end of March Madness, or the continuation of March Madness, I would say the worst situation is for somebody to wake up on April 1st and realize they have missed an historic opportunity and have to wait until the end of the year when open enrollment opens again, and coverage won't start until 2015. So my message today is don't delay, sign up now. It's easy to do, it's accessible, it's affordable, and again, I'm really pleased to be here back at Montclair State University. Now, the most powerful voice in this morning meeting is the next young woman you're going to listen to. Fozia Qadir is a consumer here in the New Jersey area. She lives right out that window, down the road a bit, and she had a situation where while she worked full-time, she had no affordable health coverage. So if Fozia would come forward and tell us her story, I'd appreciate it. Thank you.
Good morning. Thank you, Madam Secretary. Thank you, Senator Gill, and thank you, President Cole, and to Montclair State University. I'm very thankful to have this opportunity to not only speak about my experience under the Affordable Health Care Act, but to have been afforded the opportunity and the choice to enroll. I was living abroad in Egypt until January 2013, and upon my return to New Jersey, I was looking for full-time employment, until which time I remained uninsured. I was lucky to be healthy, but as I approached 29 years old, I knew that I needed to be insured. Again, I'm not invincible. Luckily, I found full-time employment in September 2013. However, it was a California-based nonprofit, and I was the only employee based in the New York, New Jersey area. My company could not add me to their plan, but provided a stipend for me to purchase my own individual plan. I thought it would be easy to buy my own plan, but I was wrong. Of all the quotes I received, they were almost always double the amount of the stipend that I received from my organization. To say I was frustrated was an understatement. Then around November, my mother, who works for a healthcare company, informed me that Marketplace had in fact opened enrollment and was beginning soon. Naturally, I procrastinated because 29 or not, I wasn't ready to concede to my mother that she was right. But eventually I signed on to HealthCare.gov. I created my account and began comparing plans. I found a comprehensive gold package and with a low deductible, and the cost was covered by my employer, with me only having to pay a nominal amount of $63 per month. So that's less than my actual phone bill. Plus $33 for dental. In January, I received both insurance cards and have received all checkups. I feel secure knowing that if anything happens to me, that I'm covered and fully capable of receiving the health care that I not only need, but that I deserve. Thank you.
And we'd be happy to answer some questions if you've got some. I'll give the state senator the tough ones. Yes, sir.
Are you concerned about the impact of 2015 premiums if not enough young people sign up?
Well, I think the entire marketplace depends on having a stable risk pool, and I think that being able to cross the 5 million threshold a couple of weeks ago and seeing interest in the website continue to surge is very good news. I think we'll have a stable market. As you know, there are some parameters that were always in the law, similar to what was in the Medicare Part D law, kind of risk adjustment and risk pool balancing that will look out for companies that have an adversely selected pool in a part of the country. In place for 3 years, goes away after 3 years, but that's always part of stabilizing a pool. I think the best news is we have markets in every part of the country. This is as a former insurance commissioner, I've watched the individual and small group market for a long time. This was always a monopoly market, and actually lots of people were locked out or priced out very early on. So we really have competitive markets virtually every place in the country, and I'm confident that we will have enough enrollment and enough young people to have a balanced risk pool as we move forward. Yes, sir.
Two questions. One to follow up on this question is, My understanding is some of the web brokers are having significantly more enrollment among young adults than in the marketplace. Do you have any idea about why that would be happening, particularly given the availability of subsidies? And the second question I have has to do with the deadlines. Kentucky, I think in the past couple of days, has said that they'll allow people to formally enroll, so select a plan after the deadline, as long as they start an application. What's your stance on HealthCare.gov and the other state exchanges in terms of that rule?
Well, in terms of web brokers, we have a lot of direct enrollment going on, so a broker or agent can actually access the marketplace information and help someone sign up. That's been in place for a long time. It doesn't mean that necessarily people are signing up outside the marketplace. If someone qualifies for the tax credit, the web brokers can actually help them access that credit and go ahead and sign them up. So we've had a variety of areas. Agents can also do the kind of direct enrollment possibility. They just come into the site, figure out if someone's available, and if someone isn't eligible based on income for the tax credit or cost sharing, they don't have to use the site at all. So there have always been a variety of choices. In terms of deadlines, we've said pretty consistently that March 31st, midnight, is the deadline for the federal marketplace. And we have not moved that date. We don't intend to move that date. So we are urging people to take advantage of the next 8 days to go ahead and sign up. I think what states also have, and this has always been in place in terms of the law, is states have an opportunity not to extend open enrollment. No one is extending open enrollment. But there are so-called special enrollment periods. Some states have had particularly troubled technology, and I think they are intending to make it available that if people are attempting to sign up and because the technology has blocked them from signing up, they'll be able to enroll. And those announcements will be made by the state-based markets.
Is it your stance, though, that for HealthCare.gov for all 36 states, that you have to select a plan by midnight, March 31st?
We have said the deadline is March 31st. Yes, sir. Yes.
Yeah. And to follow up, anybody who misses that deadline, is out of luck until the end of the year?
Yes. If you miss the deadline, open enrollment will close, and you will not be eligible to even consider new plans until the fall of 2014. I think November 15th is the first day of open enrollment for plans that will start coverage in 2015.
I've heard some news reports about security concerns on HealthCare.gov. Did you talk about the security of the website?
Well, we have had security and privacy of personal information kind of front and center from the beginning. The site was always built to the highest federal standards. It is undergoing continuous penetration testing and outside audits. We just had a full end-to-end audit in the federal site that was completed in mid-December, passed all the checks by an independent company who does a security control audit. But that isn't satisfactory. Our folks are continuously looking at the parameters, doing what's called penetration testing, trying to get in, and that will go on. It's a work of continuous improvement. I think that, certainly consumers have a right to be concerned as you see major retailers who had huge security breaches. I think that raises the concerns of everyone, but we have never had a malicious attack that is successful accessing personally identifiable information. We intend to keep it that way, but it is a work in progress each and every day.
Secretary, there are still critics. The message here is very positive in New Jersey, but there are still critics about the plan, the website, the rollout. What would you say to those critics? Your response?
Well, I guess I am. I keep being hopeful that some of the energy dedicated to, the 51st repeal vote or a series of repeats of information that just isn't correct would be dedicated to helping people understand what the law is and what their benefits are under the law. Because there's still a lot of people who were confused, and I don't blame them for that confusion because the message is still mixed. Having said that, we are delighted with the number of incredibly strong partners we have, and I think here at the college, is a typical kind of partnership where we have educators, we have health leaders, we have students, we have advocates, elected officials who are all interested in letting people of New Jersey know that the law is in place, that there is affordable health coverage, how to use it, how easy it is. And I think that at the end of the day, we are going to have millions and millions of Americans with new affordable health coverage that they didn't have before the president signed this into law. We know that 3 million adults fairly quickly who were uninsured before got insured under their parents' plans. We know that there are millions of Medicare beneficiaries who have benefited because of the closing of the donut hole and stronger support services. We know that now there are over 5 million who have signed up in the marketplace, and another almost 10 who have been declared, 10 by the end of January, who have been declared eligible for Medicaid in states across the country. That's a lot of people who are beginning to see the real benefits of this law. Yes, sir.
If someone does not sign up by the deadline, could you explain when and exactly how they'll incur the penalty?
Yes, the fee for not signing up, if you can afford health coverage, and there are some definitions in the law of what that means, what portion of your income. And let me just start by saying we have made it very clear that if you are in a state which has chosen, because of that state politics, not to expand Medicaid, and you would be Medicaid eligible, you will not pay any kind of fee or penalty, because those folks are really being left entirely without affordable care options. But if you can afford health insurance and can't, and just make a decision not to sign up, when you pay your taxes in 2015, one of the questions is, do you have coverage? Have you had coverage for the period of time? And if you have chosen not to purchase coverage, you will then owe a fee of either a flat $95 or 1% of your income, whichever is greater. And that will be assessed at the time that you pay your taxes the following year. And part of that is because we can't pick and choose when we get sick. We can't pick and choose if someone runs into our car as we're driving down the road, or if we fall on the basketball court. And hospitals will treat those patients and take care of those patients as they come through the doors of an emergency room. But if you don't have the ability to pay those bills, and you have turned down the opportunity to actually provide for yourself and your family, somebody else is picking up that tab. So your fee is really because you're spreading that risk to others at this point. You have affordable available options, you've chosen not to take them, and you're going to pass your health costs along to other folks. Yes, sir.
To meet your national goals on the marketplace, outside groups have said New Jersey would need to, enroll far more than 74,000 people for its proportion of that. What's your take on why that hasn't happened here?
Well, I think that a couple of things are going on. The 74,000, again, is through the end of February, and what we're seeing is each and every day more and more people coming to the site. You heard Fozia talk about procrastination. I don't think she's unusual. March 31st sounded like a long time away when this process started. It now is right around the corner. And what we anticipate is a lot more people taking it very seriously, saying, okay, I really have to do this. And I talk to folks every day who say, I've already picked a plan, but I just haven't quite pulled the trigger yet. So I think we'll see a lot more of that. I also think there's still, some residual confusion about, is the site working, and how do I do this? And I'm not sure if it's easy. I'm not sure if it's affordable. And all I would just urge people to do is check it out. You're here at Montclair State University. Come and talk to one of the folks in the Enrollment Center. Bring your family income and ask the question. Go on the website, call the call center and say, what's available for me and how much does it cost? And I think what, as you heard, again, Fozia talk about, a lot of people are telling me every day that they're just stunned at what options they have, how affordable they are, and how easy it was. So we're hoping that that word gets across. Yes, ma'am.
I hear a lot from people who had insurance and now perceive that the government has forced them to buy better insurance that they perceive they can't afford. Do you have a message to those people who have been mandatorily upgraded?
Well, the president put in place several months ago a transition policy that was optional at the state level and for insurers. And a lot of insurers are renewing individuals' plans, even if they weren't in the grandfather status. They did early renewals or sold the same plan. So that's step one. We know a lot of folks have continued on. I would also say that a lot of the consumer protections which are written into this law were to make sure that insurance companies can't ever again lock people out with a pre-existing health condition, which happen to millions of Americans each and every day, and can't any longer charge women more than they charge men, which happened each and every day. So a lot of women became uninsured or underinsured, and their benefits weren't often covered in the health packages. And finally, that consumers will know when they buy health insurance that it really is health insurance. Because the benefits are an insurance package including prescription drugs and preventive care and hospital visits. A lot of consumers in this market, which was kind of the Wild West, it didn't have a lot of regulation, it didn't have a lot of standardization. People bought insurance only to find out that they thought they were covered, and they weren't covered for most of what they needed most of the time. So while there are, I know, some individuals who say, if only I would just have my old plan. I think the transition policies took care of a lot of folks. They also, if you had coverage in a prior market and find the current coverage unaffordable because you don't qualify for a tax subsidy, they have the option of a catastrophic plan, which has a more complete range of benefits and some options that are needed in the future. But this is to make a market. Most people in a workplace are used to a market plan where you have full benefits, you pick and choose maybe which doctors you want to go to and how much deductible you want to make, but you don't have to read 7,000 pages of fine print to find out if you are covered for issues. You don't have a colleague sitting next to you in that same workplace who's paying a very different amount based on being medically underwritten, which this market did routinely. Every single person was basically medically underwritten. So if you were healthy and in your 60s and had not been hospitalized and weren't taking any prescription drugs, you could often find a very inexpensive plan. But those people were few and far between. And most 60-year-olds who were in this marketplace, who were taking prescription drugs and were had some kind of pre-existing health condition, were paying thousands and thousands of dollars out of pocket and often dropping out of the market well before they were Medicare eligible. So it's a way to create a market on into the future for entrepreneurs, graduate students, individuals who are shopping for their own plans, who never had the consumer protection and never had their employer paying a share of their premium. So the federal government is paying a share of that premium. Thank you all very much.